Hi, I'm Carolyn Owen. I'm one of the hematologists at the Tom Baker Cancer Centre in Calgary. I'm happy to participate in this year's iteration of CARE, reviewing some important abstracts presented at ASH this year on chronic lymphocytic leukemia. This is probably the most high-powered disease, I would say, this year at ASH. The largest number of important or interesting abstracts presented in any individual disease is likely in chronic lymphocytic leukemia. So it's hard to choose only a small number of big hitters, but probably one of the most important is the RESONATE-2 study, which was the frontline study of Ibrutinib monotherapy compared to Chlorambucil monotherapy in previously untreated CLL patients. So we know that Ibrutinib is a very effective agent. It has revolutionized the treatment of relapsed refractory CLL, especially for high-risk patients, but we didn't have any data previously to enter it earlier into treatment algorithms. So this study is groundbreaking in that regard. It does have some limitations with regard to implications for Canada, because the comparator arm of Chlorambucil monotherapy was really pretty much obsolete even as the study started. There was good justification for it and ethical validation for being able to use it as a comparator, but it isn't a standard treatment for most patients in Canada. Currently, obviously, the CLL-11 study has subsequently been published and all patients are receiving a monoclonal antibody, but even before the publication of the CLL-11 data, most people weren't using Chlorambucil monotherapy. There's also some concerns about the open label aspect of the study, and so the fact that the dropouts on the Chlorambucil arm were quite high, implying that people weren't quite so motivated to persist on therapy when they got the comparator arm. So I'm not sure that this will lead to funding very quickly in Canada, which makes the study a little bit less applicable to us, but it's still very exciting. And despite a crossover within the study, there was still a very impressive difference in overall survival favoring the Ibrutinib. So definitely Ibrutinib is a very important drug in CLL, and it will probably move further and further into treatments and earlier, likely in the treatment course for many patients.